Good day, everyone. It's me, your favorite girl, your favorite nurse Oluchi, popularly known as the nurse on Pong. And on today's episode, I'll be sharing more light on what stomatitis is. What stomatitis is. Stomatitis, otherwise known as mouth ulcer. That's the name. The medical name is called stomatitis, and in layman's language is called mouth ulcer. So I'll be sharing 5 important tips and amazing tips, golden tips of what is the queried cause of mouth ulcer. Yes, mouth ulcer, it can be defined as a medical condition characterized by the inflammation of the mucous membrane of the mouth. Yes, the mucous membrane of the mouth. Yes, once there's a mucous membrane of the mouth that serves as a protective layer of the mouth. Yes, this serves as a protective layer of the mouth. But once it is inflamed, there's a rupture in the protective layer, which is the mucous membrane, individual begin to have evidence signs of mouth ulcer. A mouth ulcer can affect the lips, which is otherwise called cheilitis. A mouth ulcer that affects the tongue is called glossitis. Mouth ulcer that affects the gum is called gingivitis. Mouth ulcer that affects the back of the mouth, that's the pharynx, is called pharyngitis. These are things that happen, and mouth ulcer can be triggered or can be caused from several things. Like it can be from herpes infections, it can be from sexually transmitted diseases, it can be from being dehydrated, not taking enough fluid. It can also be from nutritional deficiency. If the person or if the affected person is not getting enough nutrients of enough of a particular nutrient, that can trigger stomatitis. Yes, maybe you're not taking enough of vitamin C, you're not taking enough of the balanced diet, then it can trigger stomatitis. Yes, it can trigger stomatitis. Those things are the predisposing cause of stomatitis. And stomatitis can also be caused from taking of hot food. When you take hot food, hot drinks, or you take food that are too hot, just take it at a go, it can cause rupturing of the mucous membrane of the mouth. And also, stomatitis can also be triggered from the teeth. Once there's no proper cleaning, poor hygiene process or poor hygiene practice of the teeth of the mouth, can also trigger stomatitis. Maybe the braces at the teeth is not properly fixed. It can trigger stomatitis. Yes, it can trigger stomatitis. And stomatitis is properly diagnosed medically by getting a swab. Most if we report at the medical practitioner or the health facility, we rather still say that they need to get a swab to see if it is to check on the products or the sputum from the stomatitis to see the queried cause of it. Yes, and stomatitis can be properly managed. By taking this type of cream that I just want to explain to you guys to understand. Type of cream that is always applied on the upper layer of the skin. Just this is just to reduce the inflammation or the effect. But it is best managed at the healthcare facility where you get to meet your doctor. He prescribe the right medication for you to treat it, and I prescribe a corticosteroid cream that is applied on the layer of the skin, or it gets to treat the infection if it's caused by infection. Stomatitis is best managed if the underlying cause, if the root cause is properly detected. Yes, if it's for the dentures to be properly fixed, if it's for water to get dehydrated and take enough water, if it's infection to get treated for the infection. Yes, that is properly managed if the root cause is noticed, like it's indicated, like we've understood the root cause, as the root cause of the stomatitis is seen. That's how it can be best managed. Yes. And one of 5 good tips of how to prevent your current episode of stomatitis is to, number one, stay hydrated. Try to take enough water. 2 to 3 liters of water a day will do you well. Yes, 2 to 3 liters of water a day will do you well. To take enough water. To get nutritional meals, take food rich in vitamin C, take food rich in that rich balanced diet, yes, to prevent recurrent episode of stomatitis. Then another thing is that you need to get a non-alcoholic mouthwash, and this is necessary to keep the mouth and the layers of the mouth sterile, like properly clean. Because once it's not properly clean, it harbors infection, it harbors microorganisms, and it's prone to do and which can trigger recurrent episode of stomatitis. It's not advised that you at least brush your teeth morning and night before food and after meal. Brush your teeth, yes, to brush your teeth. It's very important to prevent your current episode of stomatitis. Yes. And in case you have any question, please feel free to ask me. Like, I'll be there to answer you. Yes, I'll be there to answer you. Thank you for your time. Thank you for going through, for clicking on the link. Thank you for staying tuned. Yes, please don't forget to like, subscribe, and follow for more. Yes.